Hello, welcome to Dr. Sam's anatomy classes. Myself is Dr. Azmi Mohsin, Professor of Anatomy. In this presentation, I am going to teach you about the muscles of the thigh. Okay, but this teaching method will be via the self-assessment test. Why I keep on emphasizing upon self-assessment is because the better way of teaching is you should assess yourself first. And even your MCI and the new medical curriculum from 2019 batch onwards, they emphasize upon self-directed learning. So if you recollect what you know before what I teach, that is the better method of teaching. So that's why I have given you 15 seconds with each figure. So in the initial 15 seconds, you recollect your information about what you know about the muscles of the thigh in the question, and then I'll be telling you the details of that muscle. Okay, so let's begin with slide number 1. Okay, so this muscle is iliacus. First of all, let me tell you that this shows a resemblance with some muscle in the upper limb. Like you have a shoulder girdle, you have a pelvic girdle, and in the shoulder girdle, scapula resembles ilium. Both are wing-shaped bone having concavity anteriorly, right? There you have a subscapular fossa, here you have a iliac fossa. From there, it's subscapularis that arises. Here, it's iliacus that arises. Got it? So they are compared. Now, about its origin, right? So here you're seeing this is iliac fossa. Here it's arising from the upper 2/3 of the pelvic surface of the ilium, that is iliac fossa, and then the inner surface of the iliac crest, not the inner border. So you should have this difference, that on the inner surface of the iliac crest as well. Then it also takes origin from the two ligaments there behind here, here the ligaments. These are the ventral sacroiliac ligament and the iliolumbar ligament that also provides origin to this muscle, as well as the upper lateral surface of the sacrum, that's sacrum laterally, that also provides origin to this muscle. Now this muscle is iliacus, and it forms the lateral boundary of the greater pelvis or the false pelvis. Then the fibers, you can see that these fibers of iliacus, they descend downwards anterior to the joint, and then they pass below the inguinal ligament and form the floor of the femoral triangle laterally, and then it inserts onto the lesser trochanter of femur anterior laterally, and this origin is more than the other muscle that inserts here, psoas major, but this inserts laterally and even reaches down around 2.5 centimeter to the lesser trochanter. And when this passes below the inguinal ligament, at the point of its insertion here, it merges with this another bone, psoas major. So together the two muscles have nearly the same action as well. Now about iliacus, the action of this muscle is, it's a powerful flexor of the hip joint, and its action is flexion both in the supine position while lying down position. If you want to raise your lower leg, you can raise your lower limb, or you can raise up your trunk while lying down. So it causes flexion at the hip joint, and this is also assisted by psoas major. The nerve supply for this muscle is direct branch from femoral nerve, but this branch from femoral nerve is given from femoral nerve before the femoral nerve enters the thigh. Before it crosses the inguinal ligament, it gives a branch to iliacus. Okay, so femoral nerve, by the way, the root numbers are L2, L3, L4. dorsal division. Got it? But here only L2 and L3 fibers reach to supply this muscle. Okay, so that was about iliacus. Identify the muscle, its action and nerve supply. Okay, so the muscle is psoas major. This muscle forms the posterior wall of the abdomen. It takes origin from the there are 5. It takes origin from the lumbar spine, right, and both the sides, the transverse processes from the anterior surface of the lower portion of the spines of all the lumbar vertebrae. Transverse process of the lumbar vertebrae anterior-inferiorly it takes origin, and it also takes origin from the body of the lumbar vertebrae, from the lower margin and upper margin of the adjacent vertebrae from T12 to L5, and it includes origin from the lateral surface of the intervertebral discs, also from these surface of the body of lumbar vertebrae. And these vertebrae have a concavity in between, and that is bridged by an arcuate tendon, so that also provides origin to this muscle. In short, you can remember that it takes origin from the lateral aspect of the, or you can say from the transverse processes, as well as the body of the 5 lumbar vertebrae. And then you can see the fibers that descend downwards and laterally, and they form in the abdomen, they form a floor of lot many viscera, like the lower pole of kidney, then the ureters, then gonadal vessels, then loops of the intestine. They all are resting, and even the iliac vessels, they cross here at the pelvic brim over to this muscle. Then this muscle, when it enters the pelvis, it joins this muscle iliacus, and together the two muscles, they pass below the inguinal ligament. But iliacus is a fleshy muscle when it reaches the femoral triangle, while this becomes tendinous. Psoas major becomes tendinous, and it inserts medially on the tip of the lesser trochanter of femur. So that was about the fibers of this muscle, origin and insertion, and the action. Now it also is a very powerful flexor of the hip joint. So if a person lying down supine, if you want to raise up your trunk, if you want to lift up your trunk and sit up with your hands behind your neck, and this action here, this muscle has a major role. So you can say that it helps to elevate your body while in lying down position, and not only that, you can also elevate your legs while in lying down position. Both the ways it helps in flexion of the hip joint. And other actions are like unilateral contraction. If this muscle on one side contracts, then it will cause the lateral tilting of the lumbar spine. And it also, because it's inserted medially, right, medially in the tip of this lesser trochanter, it also has a slight role in medial rotation as well. And of course it provides stability to your lumbar spine while you are in sitting position. So these are the few actions. And another important point about this muscle and the two muscle, when iliacus and psoas, when they join together, as you see that they are passing anterior to the hip joint. So in short, they also prevent the anterior dislocation of the hip joint. But whenever there is a muscle close in intimate relation to a bone, there needs to have a bursa, right? So as to prevent the wear and tear of the muscle, that there is a bursa in placed here, and anterior to the hip joint, below to this iliopsoas, and that bursa is called iliopsoas bursa. But remember, what peculiar point about this bursa is that it is the largest bursa in the human body, the iliopsoas bursa. Okay. Then about the nerve supply of this muscle is like the same femoral nerve is L2, L3, L4. So but that nerve emerges later on. Here the fibers, the root numbers are the same. So just to help you, I was telling the the roots of these spinal nerves L2, L3, L4, they directly supply to this muscle psoas major. Okay. Now there is another muscle you are seeing in green color here. Which muscle is this? Obviously you must have got to know, but let me tell you, this muscle is not always present. This is an occasional muscle. So which muscle is this? This is psoas minor. Okay, so psoas minor, if it's present, it takes origin from T12 and L1, like T12 body of transverse process of L1 and T12 and L1, as well as the lower border of body of T12 and L1, as well as the intervening intervertebral disc, that provides origin to this small belly of muscle, which soon becomes thin and tendinous. And this muscle inserts here in the iliopubic eminence, as well as the pectineal surface here on the pubis. Pectineal surface, you can say, or pectinate surface of the pubis. So this muscle, the action of psoas minor will be, again, because it is attached here, right, and it's here. So instead of flexing the thigh, it will slightly flex the lumbar spine. It assists in flexion of the lumbar spine, and the nerve supply will be from L1, direct branch from the L1 spinal nerve. Okay. Identify the muscle, its location, action, and nerve supply. Okay, you must have got to know this muscle, which has a very important peculiar point, and that this is the longest muscle of the human body, and this muscle is Sartorius. Okay, so you can see it's a strapped muscle. It categorized as a strap muscle, and you can see that its point of origin here is anterior superior iliac spine, and it descends downwards, forward, and medially, winds medially, and it forms its medial border forms the lateral boundary of the femoral triangle. Then it forms the roof of the adductor canal, and it descends down, crosses the transverse crease of the knee joint, and is attached here, anterior surface of the medial condyle of the medial condyle of the tibia. Here anteriorly there is an anserine bursa, and there are two other muscles together, the three muscles, they'll form a gyropes. So this muscle is a part of gyropes. Then you've got to know the origin and insertion. Nerve supply, action of this muscle is very peculiar. Its action is like, you can imagine, when you plan to sit down to eat food, right? Earlier in that position, tailors used to sit for embroidery purpose, right? So if you imagine you're planning to sit down there on the floor to eat food, the position, the changes in your thighs and the knee joint will be like, first of all, there will be flexion at the hip joint. Then there will be lateral rotation and abduction of the thighs, and same time there will be flexion of the knee. Got it? So that is the action of Sartorius. You can very well see it here in this image when it contracts, right, from its origin to the insertion point. There is it anterior to the medial condyle of tibia along with the other two muscles. Now this, in its contracted phase, you can see femur is abducted and laterally rotated at the same time, because it's contracting, so it flexes the knee as well as the hip joint. So these are the action of Sartorius, and these actions make it to be called a tailor sit muscle or even honeymoon muscle. You can presume the position it will adapt, that's called the honeymoon muscle, to widen and laterally rotate the thighs. And it's a part of gyropes. Gyropes are the three muscles from three different bones, that's ilium, ischium and pubis, having a common point at of insertion, that is anterior surface, the medial condyle of tibia, and these three muscles, they bypass femur, so they ultimately are balancing the pelvic girdle over the hip bones. Identify the muscle, its action and nerve supply. Okay, so this muscle you are seeing is nearly vertical in its position alignment. So being vertical, it will be called rectus femoris. This muscle also has 2 points of origin here from the anterior inferior iliac spine. This is the straight head, and there's another head, the reflected head. The reflected head takes origin from above the acetabulum on its outer surface, right? Above to the capsule of the hip joint, right? So these are the two sides of origin of this muscle, and then these two fibers, they descend down and they form a part of this composite muscle called quadriceps femoris, and this one is a superficially placed muscle in the front of thigh. And important point is that these fibers, the superficial fibers of rectus femoris, are bipinnate. Okay, and then when they reach here, they insert onto the base of the patella or the upper surface of the patella superficially, because deep down there will be insertion of vastus intermedius. Got it? So that was about origin and insertion. And of course the action will be, quadriceps, the prime action of quadriceps femoris is extension of the knee joint. They have powerful extensors, and that's why they are also anti-gravity. Quadriceps is anti-gravity muscle. But this, among the the 4 muscles in the quadriceps, only this is the muscle which also will act upon the hip joint, causing flexion of the hip joint, because it's taking origin from above the hip joint. Okay, and the rectus, the nerve supply for the front of thigh is femoral nerve, so that will supply to this muscle also. And one other important point is the nerve to rectus femoris will also supply the hip joint. Okay, so this is a bipinnate muscle, remember this. Identify the muscle, its action and nerve supply. Okay, so here we are talking about this, because this should not be in your mind, because this is not leg, we are talking about thigh. So this is a small muscle here, this is called Articularis genu. It takes origin from the anterior surface of the lower 1/4 of the femur, and with this short muscle that that is attached to the suprapatellar bursa. And suprapatellar bursa is the extension of the intrasynovial membrane out of this capsule of the knee joint. So this synovial membrane is being pulled up outside the knee joint capsule in the form of suprapatellar bursa, and this bursa is being pulled up by this small muscle, the Articularis genu. Okay, so this muscle will be covered by a very big muscle called Vastus intermedius, right? But the action of this muscle is like while during extension, right? While during extension, there are very much chances because of this suprapatellar bursa to get impinged or pinched between patella and femur. So that's why this muscle during the stages or sudden extension stages of extension, the last stages of extension of the knee joint, it pulls the suprapatellar bursa up so that it doesn't get pinched between patella and femur. Okay, so and the nerve supply to this muscle is, remember, the muscle it covers, the nerve supply to the muscle it covers also supplies to this muscle, and that is nerve to vastus intermedius, will supply articularis, genu also. Now, to compare the homology, like front of thigh is same as back of arm, remember. So there's a similar homologous muscle in the back of arm, and that is called articularis cubitus, right? And similarly is the nerve supply of articularis cubitus, and that is, the big muscle down on the back of arm, and that is medial head of triceps. So the nerve to medial head of triceps also supplies articularis cubitus, and the purpose of articularis cubitus is same, that it prevents the pinching of olecranon bursa while during extension of the elbow. Okay. Question number 6. Identify the muscle, its action and nerve supply. It's this muscle I'm talking about. Actually, it's this. So it's not actually a muscle, it's a fibrous band which blends with two muscles, and it's called iliotibial tract. It's the thickening of the deep fascia or the fascia lata of the thigh on the lateral side, and the two muscles I've already told you about in my previous lecture about the muscles of the gluteal region. There I told you that tensor fasciae latae is blended in invested in this muscle anteriorly, while most of the superficial fibers of gluteus maximus they insert on it is posteriorly, right? And this thickening of fascia in the form of tract, it descends down and then it is attached there on the anterior surface of the lateral condyle of tibia. It crosses the transverse crease of the knee joint. So, knowing this, the action of this iliotibial tract, I told you it has a lot of significance. In which position? In your semi-flexed hip and semi-flexed knee position. As you're planning to pick up something from the ground, you bend down at both your hip and knee, and in that position, if you ask to become a statue, so your body weight, holding your body weight against gravity, and your knee joint is in an unlocked position, which is very unstable in that position. So in that position, what helps you maintain your position off the ground against gravity is iliotibial tract. Got it? That was the action of this. Both these muscles counter each other. Gluteus maximus and iliotibial tensor fasciae latae, they counter each other with the help of this iliotibial tract. And of course, the nerve supply, they ask, this is superior gluteal nerve for this muscle and inferior gluteal nerve for this muscle. Okay. Question number 7. Identify the muscle, its action and nerve supply. Okay, so this is a composite muscle that's called, this composite muscle is called quadriceps femoris. Quadriceps, why? Because there are 4 muscles together, and together it's a bulky compartment. I should say that it's the most bulkiest compartment of the thigh. That's the front of the thigh, and it's the most bulkiest muscle. And separately, if individually it's asked, the bulkiest muscle of the thigh is vastus lateralis. Remember that. Okay, so the 4 muscles here, can you see the blue color muscle? I have already taught you about that, and that is rectus femoris. Then see the red color one, right? Vastus medialis, it's projecting from the medial side. Then the this yellow color one is the vastus lateralis, right? This is vastus lateralis, and the green one behind, or you can say it's like hidden by the blue color one that is deep inside, and it's vastus intermedius. So that's all. That's about these different muscles. And the origin, vastus intermedius, takes origin from the front of shaft of femur and the upper 2/3 surface, and vastus lateralis takes origin from the lateral lip of the linea aspera. On the posteriorly there's linea aspera, there it takes origin from the lateral lip, and from the medial lips that's origin of vastus medialis. Look here, these two muscles are really very bulky, vastus medialis, vastus lateralis, but they have an aponeurotic origin, a thin origin from the two lips of the linea aspera. Anyway, so these are the muscles. When we reach down, all of them insert here on the patella. On the base of the patella, upper surface, there is deep down insertion of vastus intermedius. Superficial to that, there is attachment of rectus femoris. Then on the medial border, or you can say medial 3/4 border of the patella, there is insertion of vastus medialis, while on the lateral side, only half or upper 1/3 border, there is insertion of vastus lateralis. There is this asymmetry in insertion of vastus lateralis and vastus medialis, which is a lot of significance. This patella has a tendency to get dislocated in the lateral direction. So to prevent this dislocation of the patella laterally, there are bony factors as well, but this vastus medialis has a role in pulling the patella medially, so that just to prevent its dislocation. Okay, so that was about quadriceps femoris, and the prime action of this muscle is extension, powerful extension of the knee joint. You can imagine how much this muscle has a power to kick a football from one D to the other D. Anyway, so nerve supply, of course, there are 4 muscles, all of them, they are innervated by femoral nerve. The nerve to rectus femoris, remember, it was supplying hip joint as well, while the nerve to vastus medialis, vastus lateralis, vastus intermedius, all these 3 muscular branches, they descend down to supply the knee joint also. Okay. Identify the muscle, its action and nerve supply, the green color muscle. Okay, so the green color muscle here, it's a hybrid muscle. It belongs to 2 compartments, both in the front and the medial compartment. I believe by now you must have got it, that this muscle is Pectineus. Okay, so you can see here, this origin is from the pectineal surface of the pubis, right, and its fiber descend downwards and laterally, and they get inserted on the uppermost portion of the linea aspera on the medial border, right in continuation with the lesser trochanter, right, or you can say right in continuation with the iliacus. So this is Pectineus, and in the same vertical continuity there will be insertion of adductor longus. There's a gap in between the Pectineus and adductor longus, and through this gap, it's this artery which goes behind and enters the medial compartment, and that is profunda femoral artery. Okay, so that is Pectineus, and being in both these compartments, it also is from a flexor as well as the adductor muscle, flexes as well as adducts the hip joint. And the nerve supply, because being in flexor and adductor compartment, so the nerve supply will be femoral nerve, the anterior fibers or upper fibers, and the medial or the lower fibers will be innervated by the anterior division of obturator nerve. A very important point, that sometimes there is an occasional nerve, and that is accessory obturator nerve. Accessory obturator nerve is L3, L4. This L3, L4 ventral division, this accessory obturator nerve is not always present, but if it is present, that means it's present primarily for this muscle. So Pectineus, posterior fibers, the lower fibers are preferably innervated, by accessory obturator nerve if it's present. But if this nerve is not present, then it's innervated by the anterior fibers of obturator nerve, while the upper or anterior fibers, they'll be innervated by femoral nerve. So it is a hybrid muscle. Identify the muscle, its action and nerve supply. I think I've already told you about this muscle. Yes, this muscle is in same vertical alignment at the point of insertion with Pectineus. So the muscle is adductor longus. Okay. So adductor longus के important क्या है? I missed something here, and this is that this muscle also has a second name. I'll tell you. It has a tendinous origin from the anterior surface of the body of pubis, and then it fans out. It's a triangular shaped muscle and reaches and inserts here in the linea aspera. Okay. So this muscle, if that's origin and insertion, it belongs to the adductor compartment, the medial compartment of the thigh. So the nerve supply obviously will be obturator nerve. So it's easy for you. And about the action of this muscle is adduction of the thigh, right? And remember this tendon, you can even very easily palpate this tendon. If you abduct the thighs in the groins, the tendon becomes prominent, is that of adductor longus. And so people who are horse riders, they're professional horse riders, so this tendon becomes prominent and it sometimes develops a sesamoid bone in its tendon, and that's why this muscle is also called horse rider's muscle. Question 10. Identify the muscle, its action and nerve supply. I think you should have guessed this muscle also. It's easy. It's adductor brevis by seeing the number of fibers, and it's shorter in size. And by the way, it's layer by layer we are reaching to the medial compartment. So if you dissect out this Pectineus and adductor longus, then you will find the muscle below is adductor brevis. So it actually, I told you there was a gap between Pectineus and adductor longus here, and through that was profunda femoral artery was entering, and this window between Pectineus and adductor longus is bridged posteriorly by this muscle adductor brevis, and that's why this muscle is also called the key muscle. Remember, in the gluteal region, it was piriformis, which was helping you learn the structures. Like similarly here, there was structures emerging above and below the greater sciatic notch. Similarly, this muscle has a lot of provides convenience for you to remember. Firstly, about the perforating, there were 4 perforators of the profunda femoral artery. The first perforator passes above to this border of this muscle. The second perforates this muscle. The third perforator passes below to this muscle, and the fourth also at an equidistance perforate the muscles down deeper below, and that's adductor magnus. There are 4 minor openings in the aponeurosis of adductor magnus. So this helps you learn the perforators, the positioning of the 4 perforators of the profunda femoral artery. And remember this, I told you before also in the gluteal region lecture, there's this obturator now which enters the medial compartment of the thigh, and the 2 divisions, the anterior and posterior divisions. The 2 divisions pass anterior and posterior to this muscle adductor brevis. The anterior distance anterior to this adductor brevis, the posterior division of obturator nerve descended behind to this muscle. Okay, so that's why it's called the key muscle of this region. Action of all the adductor muscles will be adduction. Now identify the muscle, its action and nerve supply. Now this also, it's the biggest muscle of the medial compartment of the thigh, and it also is a hamstring muscle. Sorry, this also is a hybrid muscle, not a hamstring, sorry. This is a hybrid muscle belonging to two compartments. It also is a muscle of adductor compartment as well as it's the muscle of the back of thigh. So that's why it also has dual innervation, and that's why this muscle is also a hybrid muscle. Okay, so the origin of this muscle, it has a lot of importance to understand. So listen. Okay, so we are talking about this muscle, adductor magnus, and it's a hybrid muscle belonging to compartments. So about the origin, it takes origin, it has hamstring portion and the adductor portion. The adductor portion, all the muscles in the adductor compartment, they take origin from the pubis. So this fibers, pubic fibers, they take origin from the ischiopubic ramus, while the hamstring fibers, they take origin from the ischial tuberosity, lower and outer surface of the ischial tuberosity. So these are the 2 points of origin. Now about insertion. This muscle has a wide, elongated aponeurotic insertion in the linea aspera, and it's slightly S-shaped insertion, and that aponeurotic insertion of this muscle has, I already told you, 4 minor openings for the passage of the 4 perforators. They haven't shown it here at the point of insertion. There are 4 minor openings for the perforating branches of the profunda femoral artery, and lastly in the down below it has a bigger opening that is called the hiatus magnus, right? So now about the insertion. Remember, the insertion also varies because it is different for the two heads. The pubic head, the purpose of the pubic head is for adduction, right? So the fibers, remember, in case they ask about the horizontal fibers or the vertical fibers, so the horizontal fibers will be adductors, because from the pubic surface, remember, the adductor fibers, the fibers of adductor magnus, they will run down horizontally and laterally to reach and insert into the upper portion of the linea aspera. So the horizontal fibers, or say little bit oblique fibers, they go and insert onto the upper portion of linea aspera, and those are fibers which are innervated by the posterior division of obturator nerve. So those fibers belong to the adductor compartment. While the criteria of hamstring is, right, so the purpose of criteria of hamstring is to reach down to the bones of the leg, or ultimately, the muscle has from the ischial tuberosity, they have to reach to the leg, bone of the leg. So although it's not a fully hamstring, let me tell you, this ischial head, right, the ischial head, origin of the fibers of ischial head, they will run down vertically. So the ischial fibers or the hamstring fibers of adductor magnus, they insert onto the lower half of the linea aspera. So remember, the vertical fibers are the hamstring component, and the horizontal fibers which are inserted in the upper half of the linea aspera, they are adductor fibers. So the vertical fibers, you can see, they are reaching vertically and leaving a space, the hiatus magnus, they descend down and attach here on the adductor tubercle, which is prominent epicondyle, just at the level of epicondyle, medial epicondyle. There is an adductor tubercle onto which these vertical fibers, the ischial fibers, they are attached here. So it doesn't follow the complete criteria of a hamstring because it is not reaching to the bones of the leg. So let me tell you, to compensate for this criteria, or to fulfill this criteria, it is presumed that from the same adductor tubercle there are fibrous band reaching to the medial side of the tibia, medial condyle of tibia, and that's called the medial collateral ligament. It's really long, it's around 10 centimeters in length. So it's a really long ligament, and that's called tibial collateral or medial collateral ligament of the knee joint here, right? The superficial fibers of the medial collateral ligament. And considering that as a detached portion of adductor magnus, you fulfill the criteria of insertion. Okay, so that was about the two different head of adductor magnus and the nerve supply, obviously, to the fibers running horizontally from the pubic to the upper surface, pubic surface to the upper half of the linea aspera. Horizontal fibers, the nerve supply will be the posterior division of obturator nerve, while the vertical fibers from ischial tuberosity down below in the lower portion of linea aspera and up to the adductor tubercle, that will be innervated by the tibial component of sciatic nerve. That's the nerve supply of hamstrings. Okay. Question number 12. Identify the muscle, its action and nerve supply. Okay, so this muscle, you can see right from pubis, it is bypassing femur to attach on tibia, and that's the criteria of a group of muscle I've already told you called gyropes. So this muscle is gracilis, right? So gracilis, let me tell you, takes origin from the lowest portion of the lowest portion of the ischiopubic ramus. And these fibers pass down straight on the medial side of the thigh, and they cross this transverse crease of the knee joint and insert here at the same position point where Sartorius was inserted with an intervening inserine bursa. So this also is a gyrope bypassing femur. And about this action of this muscle is that this muscle medially rotates the femur, medially rotates the thigh, right, as well as it adducts the thighs, medially rotates and adducts. It's although a weak adductor, but it adducts and medially rotates the thighs, and at the same time it will cause flexion of the knee joint also, and that is the position, adduction and medial rotation of the thigh, remember, and same time flexing the knee, that makes it called an anti-rape muscle. And of course, it also is a part of gyropes muscle. Nerve supply, need not to tell you, it's very easy. The entire muscle, all the muscles in the adductor compartment, they are innervated by obturator nerve, but by the anterior division. Gracilis by the anterior division. Identify the muscle, its action and nerve supply. This muscle, I already told you in my lecture of gluteal region. Remember, this muscle was taking origin in the pubic region from the outer surface of the pubic obturator foramen, as well as the outer surface of the obturator membrane, and this muscle, you can see, is winding laterally behind the neck of the femur and is getting inserted deep inside the intertrochanteric fossa. So the muscle is obturator externus. I have included this muscle here, and the gluteal region I included it because of its action with the muscles under the cover of gluteus maximus. So the action, is lateral rotation of the thigh, but here it's included because of its nerve supply being, taking origin in the adductor compartment. So the nerve supply to obturator externus, I told you in detail that its posterior division pierces and innervates obturator externus to descend down into the adductor compartment, but it's perforated and innervated by the posterior division of obturator nerve. Okay, and action is lateral rotation of the thigh. And don't forget, obturator externus also prevents inferior dislocation of the femur. Identify the muscle, its action and nerve supply. Okay, so this muscle is, now we are talking about the muscles of the back of thigh, because you can see its origin is from the ischial tuberosity and reaching down into the bones of the leg, bypassing any attachment with femur. So let me tell you, before teaching the muscles of the back of thigh, they are together called a hamstring muscle. Rather, the bulk of muscle on the back of thigh is called ham, and that's why this is hamstring. And let me also tell you that the bulk in the back of thigh is not mainly because of these hamstrings. The bulk in the back of thigh, the muscular bulk, is mainly because of vastus lateralis, vastus medialis. Okay, and this, of course, it is lying in the back of thigh, but it takes less of space. Okay, so this is, taking origin from the upper and outer quadrant of the ischial tuberosity. I believe you should be able to tell the muscle by now. It is Semimembranosus, because it's taking origin from upper and outer surface of the ischial tuberosity. Okay, then I think if you can see, it's like a 3D view, that this muscle, when it reaches down here, it becomes flattened, and it has a concavity behind. To lodge a longitudinal concavity behind, to lodge a tendinous muscle under this, to this muscle, and that's why this muscle is partly flattened and tendinous in its lower portion. Got it? Because it's lodging a muscle deep to it, which is called semitendinosus. So this muscle then crosses the transverse crease of the knee joint posteriorly and is attached to the posterior surface of the medial condyle of tibia. Got it? And furthermore, important point is that this muscle, when it inserts here onto the posterior surface of the medial condyle of tibia, its aponeurotic fibers, they pass laterally to cover the capsule of the knee joint, and that aponeurotic fibers of semimembranosus, which is spread along the capsule of the knee joint, and that's called oblique popliteal ligament. Okay, so that was about origin insertion, and of course the action of this muscle will be, extension at hip and flexion at knee. Simple. That's the action of all the hamstrings. Extension at hip and flexion of knee, but flexion of knee is the prime action. Okay. Nerve supply. The criteria says that all the hamstrings should be innervated by the tibial component of sciatic nerve. That's the nerve supply. Now identify the muscle, its action and nerve supply. Okay, this muscle, the green color muscle you are seeing, this also is taken from the ischial tuberosity, but upper and inner quadrant, right? And this muscle, you can see, is tendinous. Another important thing is that you can see in the lower portion, as I already told you, it's being embraced by the two sides, by the another muscle which is overlapping anteriorly. By the way, there's orientation is that you're seeing this from the posterior view. Okay, so seeing this posterior view, this why you're seeing is this muscle, and by the way, this muscle is semitendinosus. And in the lower portion, as I told you, this semimembranosus has a concavity or a shallow groove to enlarge this muscle, semitendinosus, and this being tendinous, it crosses the transverse crease of the knee joint and descends down to get inserted on the anterior surface of the medial condyle of tibia at the same point where Sartorius and Gracilis were inserted. So this also is a part of gyropes because it's bypassing femur and reaching to the bones of the leg. Got it? So this muscle is semitendinosus and it also is a gyropes muscle. Nerve supply of action, of course, will be extension at hip and flexion of knee, and the nerve supply will be tibial component of sciatic nerve. Identify the muscle, its action and nerve supply. So this muscle will be easy because 3 I have already told you. This one is the 4th muscle. You must have guessed by now that this muscle is biceps femoris long head, because long head is the one which is hamstring. So you can see it fulfills the criteria that it takes origin from the ischial tuberosity, while from the upper and inner portion of the ischial tuberosity the fibers take origin, and this muscle has a downwards and lateral course. Remember, if it's asked, there's only this muscle which crosses the which is placed obliquely in the back of thigh, and that is biceps femoris long head. It runs downwards and laterally. And in case if it's asked, like after exposing dissecting the back of thigh, will sciatic nerve be visible? Sciatic nerve may be visible in the upper portion, but in the back of but that will be covered by gluteus maximus. So in the back of thigh you will be able to see sciatic nerve only if you reflect this muscle, because sciatic nerve is a midline structure in the back of thigh, and there's only this muscle which crosses downwards and obliquely, running downwards and laterally. So this is an obliquely placed muscle in the back of thigh which covers sciatic nerve from behind. So if you reflect this muscle, then only you can see the sciatic nerve. Okay, so this muscle, you can see it is descending downwards and laterally to reach and get inserted onto the head of fibula. Right, the fibula, the upper end is globular and has a pointed tip above, and that's called the styloid process of fibula. But remember, it's not attached to the styloid process. Rather, there is a short lateral collateral ligament attached to the styloid process, the pointed end of fibula above. And important thing is that this tendon of biceps femoris has a splitted insertion. It splits. Why does it splits? To embrace this tendon, this ligament, that is the short head of lateral collateral ligament, is embraced by this splitted end of biceps femoris. That was about origin insertion now. And the nerve supply is very easy, that is sciatic nerve through its tibial component, and the nerves the action, of course, that's the same for all hamstrings, that is extension of hip and flexion of knee. Okay. So that was about the long head of biceps femoris that I have discussed. Now about this muscle, identify the muscle, its action and nerve supply. Okay, so I think it's easy for you to guess because there are 5 muscles in the back of thigh, out of which 4 are called hamstrings, and this one is although in the back of thigh, but it's not a hamstring. So the muscle is biceps femoris short head. Okay, so it's not fulfilling this criteria of origin, and although it fulfills the criteria of insertion and nerve supply is also, it's not the same for hamstring, and action of course is also incomplete because it has no action on the hip joint, it only flexes the knee. So biceps femoris, let me tell you, it's another important point here is that it's the only muscle that takes origin from the linea aspera. Rest all the muscles, they are all inserted onto the linea aspera. Only this muscle that takes origin in the lower portion of the linea aspera from the back of femur is short head of biceps femoris, and this muscle, when it reaches down, it blends with the long head of biceps femoris. So together the two heads, the long head and short head, they become tendinous and they insert onto the upper head of fibula by a splitted insertion embracing the short lateral collateral ligament of the knee joint. Okay, and the nerve supply for this is common peroneal component of sciatic nerve. Okay, so action wise it has no action on hip joint, it only flexes the knee joint. Identify the muscle, its action and nerve supply. Okay, so you are seeing both the two muscles which I have already taught you just now, and together the two muscles are called biceps femoris. So these are the two heads. The long head I have already told you, the short head also I have told you. Both the muscles blend together and they insert here on the fibula. Together they are called biceps femoris. Now think about, if a question comes that which of the muscle is not a true hamstring, and they give the choices as adductor magnus, semitendinosus, semimembranosus, biceps femoris. So which is not a true hamstring? Which will you rule out? Because they have not specified, long head and short head, so you cannot comment upon biceps femoris as the hamstring. Okay, and if they say the MCQ says like which of the following muscle is not a hamstring, and the choices are adductor magnus, semimembranosus, semitendinosus, and the long head of biceps femoris. So in that case your answer will be adductor magnus, because adductor magnus also completely it's not a hamstring, only the ischial part of the adductor magnus is hamstring. Okay, so that was about this muscle. Action is long head, extension of hip joint, and flexion of knees by the combined action of both the heads. Nerve supply separately, for the long head it is the tibial component of sciatic nerve, for the short head it is the common peroneal component of sciatic nerve. Last of all, this last question is identify the muscle, its action and nerve supply. So it's a composite muscle, like in the front of thigh there was this quadriceps femoris. Here also you have 4 muscles, and together this group of muscle is called hamstrings, right? You just have to identify the muscles, right? Think about the blue color muscle. Blue color is tendinous and you are able to see it from behind, right? So that is semitendinosus, right? And the green color one, which covers or embraces semitendinosus from the anterior side, it is Semimembranosus. Got it? And the red one is the long head of biceps femoris. The pink one is the short head of biceps femoris. They have not included the ischial head of adductor magnus, because that also is a hamstring. Anyway, so this muscle together form, these are the 4 muscles which together form the hamstrings. And I told you that this muscle, although this is called the muscles of the back of thigh, but they are not making the bulk of the thigh behind. It's the bulk of the back of thigh that is called ham, and it's mainly made by vastus medialis and vastus lateralis also. Okay, and the nerve supply for each of them separately, I have told you it's tibial component of sciatic nerve for all of them except the short head for biceps femoris, that is by common peroneal component of sciatic nerve. So it's done. I hope it is well understood, and if not understood, you can revise it again anytime. Okay, thank you.